Hello, my name is Maria Garcia, and I'd like to inform you what is anorexia nervosa. Many people do not know what the true meaning of anorexia nervosa is. Well, as someone who had anorexia nervosa for 2 years and still recovering from that, I thought I was overweight, and if I lose weight, I would become more happier, and people would accept me. And that was not the case. I was miserable, not happy. As I read these articles, did my research, I had this idea how I had this comparison with these other people that had anorexia nervosa, the symptoms, the effects, and the thoughts of, hey, lose weight because you're really fat or overweight. But it was not. That was an illness. Well, for my main points for today is that I would like to speak about what is the true meaning of anorexia nervosa. Secondly, I would like to talk about the causes, the effects, the symptoms of anorexia nervosa gives. Thirdly, I would like to lastly talk about how can someone recover from anorexia nervosa? How did I recover? How I am recovering from anorexia nervosa? Well, according to the January 29, 2007, the University of Pittsburgh, a member of an international group of research attempting to know about anorexia nervosa, has stated how someone with anorexia nervosa has this pursuit idea of thinness and has this obsessive thinking of fearing of gaining weight. In February 20, 2018, the article The Mayo Clinic has stated that indeed to have anorexia nervosa can lead someone to use laxatives, constantly vomit, excessively exercise to burn all those calories they have consumed in a day, and avoid eating. Avoid eating. Anorexia nervosa can even cause someone to starve for days and avoid eating meals. Would always eat meals, and they would weight themselves. They would constantly check their collarbones. They would see if they gain weight. If they did not, they would put themselves in more pain, and that cycle will keep going and going and going until they lose weight. But they're never happy with that. As for the clinic of Neverland, they state that a person with anorexia nervosa may develop eating rituals, as for saying not eating restaurants, not going outside to eat, would avoid people cooking for them. They would measure their food in the little plate. They would separate each thing so they could measure it and see how much calories it has. Does it really has 200 calories? Does it not? If it does not, well, they would take it out. So usually a person suffering from anorexia would eat 300 calories a day or 500, supposedly, or just not eat at all. So they would check themselves in the mirror and see if they have gained weight, and they would cover themselves in layers of clothes so people could not notice how fast they're losing weight, and not in a good way though. There's evidence according to the Victoria Anorexia is that in June 21, 2022, they have issued that anorexia nervosa does not require being underweight to be diagnosed. It does not matter what's your weight, because anyone can have anorexia nervosa without them knowing, because they obviously have this idea that they do not have it. But their loved ones do see that. So, first examples, anorexia nervosa would make you think constantly about food. They would try to use gums, eat ice, drink water, try to sleep, so they could avoid the idea of eating. So now that you know a little bit more, understand what anorexia nervosa is, I would like to talk about the effects, the causes of it. People who are affected by anorexia nervosa have this distorted image about their body, this can also cause them to have skin problems because of the starvation, cardiac system, and respiratory system. In the article of February 26, 2017, NIDA gives warning setups of symptoms of how when a person begins to restrict their food, they have bowel movements, constipation, and this makes them bloat and they can't really move that much around. And hypoglycemia can cause headaches, slow thinking, mood swings, seizures, and the worst case that they could die from this because the blood glucose of the levels that causes it. So anorexia can also be an emotional behavior problem. They would have mood swings, they would lose hair, they would have dry nails, they would constantly feel cold, they would faint, they would think about food, they have neck pains, and all these type of problems. Usually the most common is losing hair and having these spots of purple of how their skin has been losing too much weight in not a good way. I would like to talk about how someone can nextly I would kind of like to talk about how they can have yellowish skin and heart rhythms are different. They don't have the same heart rhythms anymore because they've been putting their body in so much pain that it's been not helping them anymore. And your body at that moment is saying that it needs to breathe, it needs help. And this person's putting so much pain in it and it can't just react to it. So now I'd like to discuss more about how someone can recover from anorexia nervosa, how like me or someone else can recover, seek help for this. Well, anorexia nervosa is mainly reaching out for yourself for help. Talking to someone is in a better way. Someone you have more confidence to talk to. You should ask them for help and say, "Hey, I want some help. Could you help me?" I actually interviewed some of my friends because I have some friends that are had anorexia nervosa and bulimia. Well, for one of my friends who had anorexia nervosa, she has told me that how for her case she had, and it was in June, in the middle of June of the quarantine. She had to go talk to her parents actually and open out, say, "Hey, I need help. It's getting bad. I have anorexia." So she seeks help to a medical profession, dietitian, and a psychologist, so they could tell and have therapy and all these sessions. Well, the thing is that she got better, and and it's great because if you seek help, you don't know how much help you can receive. Well, in December 30, 2020, the article of the Liver Piet Centers that if someone really truly wants to recover, they can choose the partial hospitalization. Well, this treatment patients are more monitored by medical monitoring. But I believe that it's better if you go ask for help and say, "I need help." And for me, that was the case. I actually seeked help. Many anorexics, it's hard for them to truly recover their favorite foods, hamburgers, eat fries. They're scared of eating that because they're fear. They don't want to recover because they think that they're gonna gain weight, all that weight again, and they believe that they're gonna become overweight, which they're not gonna be. The process of recover from anorexia is enjoying food again, not thinking about calories, not thinking about how much fat it has, being happy, being overjoyed. That's the meaning of recovering. And I will, and anyone that has ever read from these articles that anorexia is an illness, and it should not be something that any teenager and anyone has to deal with. But for my conclusion is that since now you guys know more about anorexia, I would like to talk about how this many people with low esteem it has affected. And I will thank you for hearing my speech. Thank you, and I hope you guys could inform anyone or see anyone that has these rituals. Have you seen like anyone like try to not eat? Just check on them. Check on them, be there for them, and support them. You never know. Thank you.